I think this is actually very important because, we have been talked a great deal because we know melanoma is majorly a disease affecting Caucasian lighter skin type, but we also know melanoma can occur in darker individuals like African Americans. We commonly talk about on the lower, on the foot, etc. How should we screen individuals of, let's say, skin of color or African American? How vigilant should we be? And is there any harm of doing really close follow-up and biopsy a lot of those pigmentations on the bottom feet, try to rule out melanomas?
No, that's a really great question, but unfortunately a really tough one. And it really does follow up on what we were talking about, risk stratification, why it's so important to know what your risk is of really being harmed by melanoma, meaning having what we call metastatic melanoma that's spread to other parts of your body or potentially dying of the disease. The bottom line is any single death from melanoma is a tragedy, and we'd love to prevent every possible death from melanoma. That said, you use the word screening. And the reality is, we know for any disease that screening is a double-edged sword. And that when you're screening, you're in the process of trying to save lives by finding some things early. You end up labeling a lot of people with the disease that were never going to be hurt by it. And so if we screen the whole population for melanoma, we might save some lives, but we're going to end up finding spots that may not be melanoma, but that we're doing biopsies for that end up having a lot of problems just from the biopsy. And we're going to end up labeling a lot of people with very early melanomas that might never have gone on to hurt them because either they weren't going to live that long or the biology of their melanoma wasn't that serious. And that's why there are groups like the U.S. Preventive Services Task Force that come out with recommendations that we know that screening is a good idea or a bad idea based on the likelihood it's going to do more good than harm. And it's important to know that where cancer is concerned, that's really only a few cancers where it's absolutely well agreed upon. Cervical cancer, breast cancer in the right age groups, colon cancer in the right age groups. But that when it comes for screening other types of cancer, it doesn't make sense if other than to do it in parts of the population that are really likely to get the serious disease, because you just have to be cautious about the harms that can happen. So now let's go back to your actual question. What about populations with skin of color, okay, and melanoma? It's absolutely true. Anyone can die of melanoma. And there have been some very famous Black individuals who've gone on to die of melanoma. But the reality is, on average, across the entire US, the number of people with Black skin, and again, how you define skin of color is also a challenge, who actually die of melanoma each year is well under 100. And when you're talking about potentially screening millions of people with the hope of finding one of those less than 100 melanomas in a way that'll make a difference, because it's also just, it doesn't make a difference if you screen people if you're not saving lives, right? If the screening is going to find a melanoma that's already a little bit more advanced and going to hurt you anyway, you did not help them, right? If the screening is finding a melanoma that wasn't destined to spread, you're not helping them. So it's only a subset where you're going to be able to help them. And one of the challenges is, as we said earlier, most melanomas are sun-related, and people with really dark skin don't get sun-related melanomas as a rule. So it turns out they get the exact same percentage of people, whether you're very fair complected or very, very dark skinned. The rate of getting these non-sun related melanomas is actually almost identical across all people. The difference is, if you look at fair complexion people, their sun-related melanomas outnumber their non-sun related melanomas, 20 to 1, 30 to 1. So what ends up happening is it makes up a minority of those. Whereas if you look at that small number of dark-skinned people who go on to die of melanoma, almost every one of them is one of these non-sun related melanomas. Well, those happen in places like the palms, the soles, under your nails, in your mouth, on your genitalia. These are also places, if you start doing a lot of biopsies and treating a lot of spots, there's a lot of morbidity,
I
even
mean,
just from the biopsies.
yep.
And so, the short answer is I don't have an answer for how you increase detection pressure in a population that's got a very low risk of dying of a disease without risking more harm than good. And so, the approach I think we're taking right now is make sure people understand not to ignore an obvious concerning spot. So no matter what your skin color, you have an obvious dark spot on your palm, your sole, your nails, your mucosa, and it's changing in a concerning way. Of course, get it checked out. But I'm personally very concerned about this notion of trying to raise awareness in the skin of color community. And again, it depends on the community, right? The fair-skinned Hispanic community, which might consider themselves skin of color, is at greater risk for getting sun-related melanoma than the dark-skinned community.
Well,